It's another very beautiful Thursday morning from our studio, IKD 106.1 FM. You're very conversant with the issues every Thursday where we talk about healthy conversations. Of course, they say health is wealth, and that is why we are in line with Ikorodu General Hospital, bringing you conversations from our health-related matters, bringing this to your ears every Thursday morning from 11 up until 12 p.m. This is how we do it every Thursday morning. I'm not alone in the studio this morning. With me in the studio is a doctor from Ikorodu General Hospital. I'll turn on the microphone for her later on during the conversation. But before then, do not forget, of course, that you can listen to us from anywhere all over the world via our website, www.ikd1061fm.ng. We are also very much available on Radio Garden, IKD 1061 FM. My name is Okpeyemi Adebambo. I'll be your host for today on the issues where we will talk about another deadly disease. Actually, this time around, we talk about one of the types of cancer. We have several types of cancers, and one from all of these types of cancers will be our focus today on the issues. We're going a very short breather. When I return, the issues continues. Good morning. Oh yes, you're welcome back to the issues on IKD 106.1 FM. Earlier, before that short breather, I told you we will talk about one of the types of cancer, and today we talk about cervical cancer, another very deadly disease that has taken the lives of so many all over the world. And to prevent this, of course, the conversation will start up with my guest in the studio, talk about a consultant from General Hospital, the obstetrician and the gynecologist department from General Hospital Ikorodu, in person of Dr. Mrs. Fatimat Amoke Rabiu. Good morning to you.
Good morning.
It's good to have you in the studio.
Good morning, viewers at home and listeners at home. I remain Fatimat Amoke Rabiu, an obstetrician gynaecologist. Happy to be here today.
Thank you very much. It's good to have you in the studio. We are talking about this type of cancer that is very deadly and, of course, has cost the lives of so many people out there. First off, to start up this conversation, how do you, as a medical practitioner, define cervical cancer?
Yeah, thank you very much. Let's start with what cancer is.
Yes,
cancer is an abnormal growth in the body. It's a new growth, but it's abnormal. And there could be several growths in the body of a woman. But when we are talking about cancer, it means it has gone beyond something that is normal and is going to cause a lot of trouble, a lot of sequelae, complications for the woman. And once that growth starts, nothing stops it. It becomes so uncontrollable and it will affect all the systems in the body. So cancer, sometimes we call it carcinoma.
Okay.
The Yorubas in this part of the world, they call it jejere.
Okay.
But cancer is an abnormal growth in the body. And when we have termed it cancer, it means it is a malignant growth. It means it's a growth that is going to affect the quality of life of the patient. Now, for women, there are so many parts of our body that could be cancerous, okay? And the one we are talking about today is cervical cancer.
Yes, please.
It is very, very common in this part of the world. In fact, up to over 12,000 cases are detected annually. And a lot of deaths, up to 90% of deaths, arise from cervical cancer. So that's the brief overview. It's something that we should be aware of. Prevention is always better than cure. But as we progress in this talk,
definitely, I want to agree with you that prevention, they say, is better than cure. And when we talk about the cervical cancer, you talk about women are more likely to these forms of cancer because of their kind of a body system. Are you saying that cervical cancer is a cancer that belongs to the women alone?
Yes and yes and yes. A lot of us would have had one form of biology done when we were in secondary school. True. So we have what we call the male reproductive organ and the female reproductive organ. So males don't have cervix. It is females that have cervix. We have our ovaries, we have our fallopian tubes, we have what we refer to as the uterus, to the layman we call it womb. We have what we call the cervix that we are coning down on today, and we have what we call the private parts, the V area, the vagina. We have what we call the vulva. So for a woman, that cervix is part of a female reproductive system, and it is hidden. It's not so apparent, unlike when you see something on your skin and you can say, oh doctor, I have a boil. You can easily, because it's seen. Yeah, but this one is hidden. It's somewhere that is private, for the woman, for her spouse if she's married, and that's why most times when there are issues in that area, it goes unnoticed. So our campaign is like, we need to be on top of our game as ladies all the time, as spouses of our women, to know that this risk is there for every woman in the reproductive age group, i.e. from age 15 years to up to 49 years. Wow. Because those things get worse during those periods. So that's basically what it is.
But from the age of 49, are you saying if a woman gets to 49, then she's safe from cervical cancer?
Yeah, in fact, what I'm trying to say is that reproductive age group, because if a woman is married, she's just giving birth, she's breastfeeding, after 2 years, she's gotten pregnant again. Even when she has it around that duration of age, she might not notice. So later, a lot of them is when they are now 60, 49, 52, they've stopped breastfeeding, they've stopped giving birth. That's when those symptoms will now come out, blown out. So we don't want to wait for that time, because that time it would have gotten to a stage we call advanced, and there will be little that we can do. So our talk is always, let us see how to prevent, how to screen, how to diagnose early, and how to treat promptly.
We will talk about the causes of the cervical cancer, and of course we look at how we can prevent them, of course. But even before that, talking about the age bracket now, are you saying age 15 to 49? Now, are you also saying that when you are a youth, there is every possibility, or only when you start producing children as a woman?
Thank you very much for that question, because it's very, very important and it needs to stay with us. The risk of cervical cancer is in every woman, as I've earlier mentioned. However, it is worse in women that have certain risk factors. What I mean by that is, yes, we have 100 women. Out of these 100, 90 of them are at higher risk. What makes them have those higher risks? That's what I'll mention briefly. One, if a woman had forced sexual exposure, I'm sorry, we need to mention some terminology. Pardon me for some. Like, even if she was raped at the age of 15, she has that risk.
Wow.
Or if she's probably in those areas that they marry early, for instance, in the northern part of this country, and she's already 15, 16, 18, she's married, and she has had her first sex, she's at the risk. If in her family there's an auntie, first degree relative, a mother, a sister, elder, younger sister, a first cousin, if any of these people have had cancer, then she's at the risk of having cancer. Two, if she's a black race, we are all black here,
of course,
the risk is there. Three, there are some people that would have done some insertions, they would have used some agents, some drugs that were given to them by quacks. So many things would have happened in that area, and our body system, immune system can be reduced. So some are lucky. Once that thing starts happening, their body response can mount the infection. But if their body response is not enough, then they will break down with infection, and all those changes can make that patient have cancer in future. Those are the very apparent risks that we can talk about now. So, however, the good news is it's a cancer that is curable.
I was going to ask you.
Yes, thank you. It's very, 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 mark my words, very curable, because if you are able to detect it early, then you are very good. But how do we do this screening? How do we detect it so that I'll know, oh, I don't want to have it? You understand? Now, I need to mention this. What happens in cervical cancer is that there are some changes in that covered area I mentioned earlier. However, when those changes are not taken care of by the body repair system, then the woman will start having those changes turning to abnormality. The funny thing is, what causes cervical cancer is actually gotten from men.
Okay, I would want to interject you there before we go ahead. Now, you were saying something about this cervical cancer that it could be hereditary, if I'm not mistaken.
Yes.
So, from a mother to a child, maybe from a mother to a female child, is it also possible that there could be a transfer from the mother to a child? This disease cause of is it possible?
Yes, that's what we call the familial or the genetic predisposition.
Okay.
That your mommy has had it. In fact, if you come to the hospital, one of the questions is, is anybody in your home, your mom, your auntie, your sister having breast cancer, having ovarian cancer, having cervical cancer? So it is very familiar, and you can't change your mother. You can't change your sister.
Definitely
your
not.
sister will be your sister forever. Your mother will always be your mother. So, but once you have that risk, you are number one set of those people that need to get screened on time. Don't wait for when the thing happens to you and you are 13th hour to go back to God.
It has gotten to the advanced stage already.
Exactly.
We will talk about the causes, Dr. Fatima. I'm enjoying this conversation. Of course, I'm learning already. I know when you talk about causes now, and my mind is prepared to hear that men are
they're the culprits.
That's amazing. Anyways, but before that, looking at the types of cancer we have a lot of them. There's some from the breast, the eyes, the nose. I was even surprised to see that of the ears. A lot of types of cancers, but how deadly can, you say it's curable, but how deadly can cervical cancer be? Some persons will just tell you it is cancer. We hear different types of cancers. What makes this different? How deadly is it?
Why it is severely deadly, if I need to pick those words for us to be able to have it restated in our brain, is that, like I mentioned earlier, it's from an hidden part of the woman. Every matured lady girl is always shy. In fact, when we were small and we were having some itches, or that lower down is scratching us, those kind of scratching that you want to take maybe a fork, or you want to use nails if you have long nails to scratch.
To do a proper scratch.
Yes, but the girl is shy. She can't even tell her mom, not to talk of telling her dad, not to now talk of going to the doctor. And when you now get to the clinic or hospital, the first person you are seeing is a male. So even at homes between siblings, the girl is like, don't come to the toilet, I'm bathing, I'm having my bath. They are shy once they are getting to that maturity stage. So that part of it's a covered area of our women. It's an area that even when we have complaints, abdominal vaginal discharge, itching, we are always shy in going to complain. So some people would rather go to the roadside herbal concussion seller and say, please give me something.
Just mix up something for me.
So that's why it is deadly, because it is not detected on time and it would have gone far in the body before it is detected. And by that time, we might not even be able to help her optimally. So that's why it is very deadly, and it's actually the fourth common cancer in women, affecting women, and it's the third one that is so common in gynecological cancers. So it's such that it's called by what we call the human papilloma virus that I mentioned earlier, or I was going to mention, and the HPV, we call it HPV, human papilloma virus. Viruses are very deadly. We all know Ebola. True. We know what was that other one, COVID-19 that was turning everywhere upside down. We know human HIV virus. So anytime you have virus, you know that, God help me. So now this HPV is also the culprit here. Well, we can't blame nature. Science, we say nature. Some we say God. That's the way it has been made. The men are those that have the human papilloma virus. But it doesn't affect them. That's the funny part.
Oh, that's so good.
I wish we can reverse things, but so it doesn't affect the men, but it's the men that are now the caveat emptor. They are the ones that deposit and dump it in the woman.
It's not our fault, actually.
Sorry about that. I agree with you. Now I need to mention this, and pardon me, I forgot. One of the risk factors for that woman, again, any particular woman that is going to have a very high risk of having cervical cancer, is if she has multiple sexual partners. I will explain that in a bit because it's very, very important. Let's just take the outlier. Imagine a girl had been raped by 5 men, and each of the men have different kinds of the HPV. They are what we call strains. They are like different kinds of, like, we are human beings. Some are tall, some are short, some are big, some are leper. slim. So those viruses, there is 16, there is 18, there is 32, there is 33, there is 35, 42, 44. There are a lot. So if 5 men gang rape the lady, and each of those men have different viruses, that lady already has 5 different types of those viruses
already.
And when they start acting like, no control. So let's leave the case of somebody was raped. She's a lady, she's not yet married, she's doing runs. I don't know, some call them Olosho, some call them sexual worker, etc. Now she now has several. Some they will say, oh, if I use CD barrier method, condom, this is the pay you give me. If I'm doing skin to skin, this is the. So imagine these ladies.
Oh, there are different pays to it.
I should be asking. I'm trying to learn too.
I wouldn't know.
But these things are there. It is what it is. So, and we need to talk about it.
True, definitely.
For our people to be aware.
Yes.
So imagine if she's been doing skin to skin with 10 different people in Allen Junction today, in F1 tomorrow, in Fella's trying the other. At least we were growing up and we know all these things.
Yeah.
So she now has a garbage of like 20 different kinds of HPV viruses. When she falls ill, she does all the anti-malaria. She doesn't get better. The thing is now, it's like the men have like, what's this thing the farmers do? They have implanted the seed. So the thing is going to germinate into cancer.
Wow.
Some are lucky. The infection will die down because maybe they've been taking a lot of drugs or they went to the appropriate place. Now, the headache we have is now she's not even promiscuous. Okay. She has not been gang raped. But she's with a man that probably has slept with 20 women. And each of those 20 women has slept with 10 men.
So it's a circle.
It's a chain that it's like a cake of gunpowder waiting to explode. So you don't know who is who. And that's why the screening is important. Because it's not written on the face. It's just like HIV. I can't just stare at you and say,
positive.
Your enemy has HIV. So for the woman, she needs to take care of herself right from cradle, I'm not saying men should not take care of themselves. But the girl child has some peculiarities, menses, she's having all these symptoms, her breast is coming out, her bum bum is shaking, somebody is toasting her on the road. So we need to be counseling our girl child for all this. And the men, it is not that they are happy that they are the ones giving the women the HPV virus, the human papilloma virus, but that is why the essence of screening is very important. Then there are some families that maybe the man is actually married to more than one person, and you can't say the other woman or the other women, you cannot verify the kind of sexual life they had before. So that is why it is not anything. We are not scolding anybody, but get yourself screened so that you'll be globally optimized for the happiness of yourself, your spouse, your family, and the whole nation and the whole world.
We'll talk about the screening procedure and how that goes. But if you're just joining us, it is still the issues on IKD 106.1 FM, where we talk about this deadly cancer, cervical cancer that affects the women, the girl child. And of course, with me in the studio is Dr. Mrs. Fatimat Amoke Rabiu, consultant from General Hospital Ikorodu. Doing this conversation together in the studio. You can be part of this conversation by calling into the studio lines if you have questions to ask our doctor on 0904-081-1061. That is 0904-081-1061 or 0904-082-1061. You can also send in text messages or WhatsApp messages to our studio line 0904-082-1061. 0904-082-1061. Dr. Fatimat, thank you for still staying tuned on the issues today. Now let's talk about the causes of this deadly cancer. You've touched it on the surface a little bit, but now let's talk deep into some of the major causes of this cervical cancer to women.
All right, thank you very much. Now, I have earlier mentioned the risk factors. Let me restate it for people joining us. I've mentioned that if a girl child had early coital, we call it sexual exposure. Like she's somebody that has started having sex, even if she's married, and she has started having sex at 18 or 20, or she's somebody that is having multiple sexual partners, or is somebody that her mom or sister has it. Okay, then if she's a black race person, then things like reduced immunity. If that lady is actually somebody that has HIV infection, or she has other viruses. In fact, those viruses are just wonderful, and they can't even be seen with the eyes. They are microscopic. So if she's somebody that has had hepatitis B virus, she has had human immunodeficiency virus, she has started coming down with AIDS, the syndrome, she has syphilis, she has untreated urinary tract infections, she's had tuberculosis, all those things that can make the immunity of somebody almost zero. All those things also will predispose that woman to cervical cancer. However, the major culprit is that HPV I've mentioned, and because it's not usually detected in women on time, and it's not written on the face of the man that you have it. Wait, you can't be my husband. I think you have HPV. You can't be my boyfriend. I think so. That is why we need to always drum it that let us screen ourselves. Now, one of the other things that will affect the woman without her knowing, and she's now coming into the advanced stage, is this: because the place is a private area, if she's even having things like abdominal vaginal discharge, she won't know. However, we always talk about the symptoms, so that when the woman has this thing, she's running to the right place. She's not going to a quack. If a woman is having sex and during the procedure, the other room affairs, she's bleeding. We call it
those are the signs now, the symptoms of this disease.
Now, symptoms are the things the patient will come and tell us that she has observed, while signs are the things we as doctors will elicit in the patient. However, for things like that she was having sex with her spouse, her boyfriend, as the case may be, or after sex, and she was bleeding, and she's not in her menstrual time, she's not having menses. So postcoital sex can be a very big symptom, and a lot of ladies too will be shy to go and complain. She might even be thinking, was the guy too rough with her? Was he hard on me? Or stuff like that. So she might take it casually. That's one of the things. The woman might be losing weight. Let's forget the women that are saying they are doing keto dieting or they are gymming, which is good. You need to do regular exercise to keep fit. But when you start losing weight without it being accounted for, the pants you bought 2 weeks or 2 months ago is now it's now sagging. It's now like boxers.
You need to start slim fitting.
Exactly. Or people are like, don't let me mention name, Mrs. A, what's wrong? You look so lean. And you'll be like, really? Your wristwatch is sagging. It's no more holding. You understand? Your dresses are now sagging as if you are sagging. Your trousers, like some men do. So all those symptoms are very important. The woman might start looking emaciated. You might be seeing some bony prominences in her chest, in her face. Then there's this thing. Usually ladies have what we call vaginal discharge, which can be normal. Physiological, that's what we call it, and which can be abnormal, pathological. But when a woman starts having a discharge that is smelling like spoiled fish, the women that cook well for their husband and you make fish, is it Titus salmon? When you do that fish and you leave it in your kitchen or you leave it in your trash bin in the kitchen, you know how it smells after some hours. So if a woman starts having that kind of smell, that is big trouble. Or you start having a discharge that is so offensive and you start having to wear not even panty liner, you start wearing maybe pad to take that discharge, and you enter a room and everybody's like, God, where's that smell coming from? Use all the perfume of this life, that smell will still be there. So there's what we call the foul smelling copious vaginal discharge. Foul means it is smelling like soak away. Copious means it is plenty. Discharge from the V area means it's coming from that down area. So that woman she's not somebody that will go to the pharmacy on the road or go to Yalagbo on the road and say, give me this. So all those symptoms, signs are there for the woman to note on time. And that's why we need to come for the screening. And the screening is very affordable. very accessible, very cheap.
Let's talk about the screening, Dr. Fatima.
Excellent.
What does it take? What are the procedures, the stages for the screening? How? Because I know there are some people listening right now and they want to be a part of this screening. They want to also be sure of where they actually belong. Good enough, it's a curable cancer this time around, unlike some other kinds of diseases that are not curable. So, what is the screening process like?
Yeah, thank you very much. The screening is very, very simple. It's not cumbersome.
Okay.
It is not expensive. Luckily, there are some NGOs, the government, also like public health institutions. They've made all these things very easy for patients. Some even dedicate specific days. Every Monday, everybody come for free screening.
Okay.
Before, it used to be something expensive, but now, so one of the screening is just that it involves things like you need to expose that covered area. And of course, it's always done with privacy. Nobody will put a woman where everybody is and open her up. So it's usually done in a clinic. It could be done by a doctor, a medical officer, a senior midwife, a matron, a nurse that has been trained for that. Now, those screenings, there's what we call pap smear. That's very simple too. They will open up the place. There's something we call a speculum. We use it to open up that area. You know, I told you it's a narrow part.
Yeah.
So, but we need to have it, expose it, see the place very well, and we take something like just a brush kind of specimen. Just imagine the brush you use for your dentist, for your dentition, for your teeth. You will just scrape it, and that's all.
Dr. Fatima, I hope you're not scaring people right now.
No.
Won't that look painful?
It's not. We call it a side.
For those that are willing to come now and they hear you brush it.
Okay, just even assuming like a cotton board. Those things that you use for your ears. You're cleaning
it's
your
a flexible
wax.
one.
Yeah.
Oh, okay, nice.
You won't even know anything happened.
Now, I was thinking maybe the same kind of brush.
No. I was just trying to give you a picture that, okay, we'll just put something and just clean it.
But it's not painful.
Not at all. In fact, if it pains a patient, that patient should give me query. It's painless, it's
you all will hear
seamless.
that you're hearing the voice of Dr. Fatima. She says if it's painful, give her a query. So take her for her words. I take her for her words.
Yeah.
I think we should quickly attend to this message. Sorry.
Okay.
This person is saying, Arewa is asking the question, does this cancer affect the cycle of a period, a woman's period?
Yeah. Thank you, Arewa, for that question. Like I mentioned, that a woman can actually have some kind of strange bleeding. Not only even during sex, she can have what we call intermenstrual bleeding. And she will wonder that I finished menses 5 days ago now. Why am I seeing blood again? And she didn't even have sex. So it could actually occur that she could be having some irregular kind of bleeding from my private area. It could be a sensitizing warning sign. So she needs to know. We should not just take for granted business as usual. So it's possible.
Yeah,
but we need to know and be sure, and that's why the patient needs to come
for the screening. Let's take just one more question this time around. Let's take from WhatsApp before we proceed with other conversations on the issues today. Cervical cancer is the conversation on the issues. This person says, hello, good morning, my name is Rotimi. I'm currently listening to the discussion on cervical cancer, and my question is that I had 2 stillbirths in the last 2 years, and I was told that I have weak cervix. Is it a high chance of cervical cancer, and can the cancer cause one to miss period for months?
Rotimi, thank you for your question. You need to say gynecologist ASAP. However, what you've been told is that your cervix is weak. We call it cervical incompetence. Okay, that is different from cervical cancer. Cervical incompetence means that you get pregnant. However, when the pregnancy is getting advanced, when the womb is getting bigger, that cervix is like a funnel. You know, the womb is, God made it in such a way that it encapsulates the baby very well. It keeps the baby safe. But by the time the baby is ready to come out, that cervix is what we open to bring out the baby using the head. If it's the head, the baby is coming with. So if a woman now has a weak cervix, that's the word, we call it cervical incompetence or cervical insufficiency. It means that cervix is not strong enough to keep a baby to 9 months. So what she's having is not cervical cancer. And that's probably why she had issues with her baby. Those babies didn't make it and all that. So her case is different from cancer.
Okay.
Yeah, she shouldn't be worried, but she needs to always go and see a gynecologist for her to have a live baby and be happy.
Oh, you've heard that, Rotimi, from Dr. Fatima. Now, Dr. Fatima, about this screening, I want us to still talk more about it. And you said it's not very... For General Hospital Ikorodu, how does it work? I know sometimes ago there were what's it called, free screening for diabetes and some sort of kind of different illnesses and all. For cervical cancer, are there any forms of free? Can we just come anytime? Is there a particular day? And what does it look like? Okay, so from Rotimi, she wants to agree with you on this one. So she's saying, thank you so much, doctor.
You're welcome.
From Rotimi.
That's a pleasure. All right. Yeah, thank you again. On the screening, I had not exhausted the different modes of screening we can do.
Okay.
But the lady should know that one of the screening maneuvers or procedure we do involves her coming for us to check her under. And like I said, it's a seamless procedure. So there is the test we call the pap smear. There are even some very cheaper ones. There's one we call VIA, visual inspection under acetic acid. Okay? VIA. It's not VIO.
Okay.
VIA. Visual inspection under acetic acid. Okay? So that one also involves us opening up our cervix with what we call a speculum and checking. We put the acetic acid, and the areas that have abnormality we know. The ones that are normal we know. So it's more like an instant result. There's another one we call VILI, VILI, visual inspection using Lugos iodine. VIA, visual inspection using acetic acid. VILI, VILI, visual inspection using Lugos iodine. That one too is simple. We just open and we just put the Lugos iodine, maybe with cotton wool, something very soft. Like I said, she won't even feel it. And we check the area and see the abnormal ones. So the iron one is now the one we call the pap smear. Which I said can involve using something like a cotton board. But that one we now take it under microscope. So that's why this screening has to be done by professionals, nurses that have been trained on it, doctors that have been trained on it. The pap smear, we call it, is a shortened form. The real long name is Papa Nicholas smear, but you know the name is long, so we just say pap smear. That one is such that once we take that swab from the woman in that private area, that cervix, we will now put it under microscope. Okay, so the microscope will now see even the minutest abnormality for us. Okay, there's another one that we call oil-based. Instead of just taking with it with that swab, we are going to take it and put it inside the reagent. Then there's another one we call colposcopy. That one is an higher level of microscope. We are actually checking, putting the microscope and shining lights. When we shine the light, it will see some abnormal vessels, because if this cancer is there, those vessels are there, angry looking. They are angry. They are trying to get nutrients, making the woman's life very difficult. So once we use that colposcope and we put what we call a silver nitrate agent, the thing will come and we will see. And we can actually say, this is stage 1. But the lucky thing why I mentioned that is curable initially is that there is a stage we call Cyan 1, Cyan 2, Cyan 3. I will mention it.
Okay, let's just take this call quickly. Let's not ignore all the calls. Hello to you. Good morning. Hello, good morning. You're online. Good morning. Good morning. Your name, please.
Good morning.
Yes. Hello, what's your name? Hello. Okay, you can call us back on 0904-081-1061 or 0904-082-1061, 0904-081-1061 or 0904-082-1061. So talk about the 1, 2, 3.
Yeah. I'll break it down. Don't be afraid.
Please.
I'm very simple when it comes to English. And I synchronize it with our medical terminology. Some people call it medical jargons. Now, why I mentioned that it's very curable is because the thing will not just jump to cancer. It actually takes up to like 20 years. And that's why if that lady has had her first sexual exposure at age of 20, she has a whole 20 years to actually develop cancer. So she has enough time. if you are sick 2 years, you will go to the hospital. If you have been happy 5 years, something will happen to you that you just go to the hospital. So what we call CIN is cervical intraepithelial neoplasm. What that means is the thing is still inside. It has not come out. How do I explain it? It's still playing inside. It's still playing with you, trying to see if your immunity can surmount it. And those are what we will now see when we do that one that I call colposcopy.
Okay.
That one that I said is a special kind of microscope that we check the cervix. All right. So it will tell us when I see the vessels that are plenty, they are angry looking. They are so much that they are branching off, and they are a lot. So it can now be 1, 2, or 3. And that time, if it's a woman that is no more interested in giving birth, or she has even delivered all her children, she's no more desirous of having pregnancy, we'll just bring out the whole cervix for her. We'll bring out even her womb, so that she won't have that risk anymore. But imagine that we didn't detect it within those 20, 30, 40 years. She's now coming when she's 60 or 70. The thing has already jumped from CIN 1, CIN 2, CIN 3, has started going to stage 1, stage 2, stage 3. Most of them in this part of the country or the world, they come in a very bad state. When we cannot even, in fact, when we tell a patient that I can still remove your breast, I can still remove your cervix, your womb, it's good news
for them.
So it's good news. But if you come and I'm saying sorry, it's radiotherapy, it's some form of chemotherapy I need to do for you, it's usually what we call palliative treatment. Okay. Because at that moment we can't guarantee you 100% cure. In fact, that's why we need to catch you before you get to that stage. So it's good news when you come early, we screen, we find the level you are. The thing might not even have started. Okay, now we need to still talk about prevention.
Yes, please, we'll get there.
Yeah,
we'll get
so
there.
that's basically those screening tests, and they are not expensive.
Okay, let's see if this call will go through. Hello to you. Good morning.
Good morning.
Hello, what's your name? Hello. Okay, you can check back. I think the network from your end is not very fair. We will talk about the preventive measures. Talk about this disease, and then you said this can last in the body for 20
several years. Yes.
Wow, that is very serious. Now, we know of chemotherapy, radiotherapy, even surgery, I think, if I'm not mistaken. But then, how can it be treated? Before we even talk about how we can then prevent it, how can we treat this cancer?
The management of cervical cancer starts from the preventive measures. If she's not lucky, we'll get to prevention.
Yes.
But now, if we have detected that she has that that's the 1, 2, 3 I mentioned.
Yes.
We actually call it pre-malignant lesion. Let's say pre-malignant disease. Let me just say it like that.
Okay.
Pre-malignant means before it becomes cancer. You understand? Pre means before. So if we catch you before that time, it's good.
Okay.
Now, what we determine what I'll do for you definitively at that time is, are you still interested in getting pregnant?
Okay.
Are you somebody that you have completed your family size? You've had 2, 3, and you are okay. Then I'm going to yank your womb away.
Wow.
I'm not just going to put under, I'm going to.
You know, the way you said it, I'm thinking
I want it to sound
You know, when you said it, the next thing I looked at was your hand. I was like,
I don't want to scare my audience. So it's a good thing if I can catch it early, and you are somebody that is not interested in getting pregnant again. I'm just going to remove your womb, remove the cervix, but I'll keep your vagina intact, because you still need it for the other room.
But will a woman still remain normal without her womb?
She will.
Oh, really?
Yes. In fact, when we do that kind of surgery, we remove her ovaries as well.
Wow.
Yeah. So if it's somebody that has not even entered menopause, she'll have what we call surgical menopause. But there are lifestyle modifications that will offer the patient that will make her sex life okay. The only thing is she won't menstruate again once I remove her ovaries, because once somebody has cervical cancer, the blood supply in that area also gets to the womb, gets to the ovaries, gets to the fallopian tube. So I want to optimize her and make sure that I remove all those things in peace, so that she can have a peaceful life and she will not be in pieces. So,
but this is usually done. You usually do this with their consent.
Yeah, of course. In fact, there's what we call informed consent. Informed consent means I've explained in detail what this surgery is all about,
and I am aware that I want to go through
exactly.
this. Nice.
So
nice. So let's now talk about how we can prevent this before we even wrap it up today on the issues.
All right.
How can we prevent it?
Yeah. Everybody knows that saying, that aphorism or idiomatic expression that says, okay, prevention is always better than cure. So it's in our own interest that we are well informed and we need to know how to prevent. Now, for cervical cancer, there are 3 basic major steps of prevention.
Okay.
There's what we call the primary prevention.
Okay.
Primary school. Primary prevention,
yes.
Secondary prevention,
okay.
And tertiary prevention.
Okay.
1, 2, 3. Okay. It's just like when you take your what's moi in English. You want
bean cake.
You want to start it from the lower part. Though things have changed. The children of today will say, I can start from mountain if I want. I don't need to start from So primary prevention involves things like taking the vaccine. You know, I mentioned earlier that the virus is gotten from men, even though it doesn't affect men. The WHO recommendation says that even now, we can give the vaccines to the men.
Okay.
If we give the man the HPV vaccine, they will not have it.
So they won't spread it?
They won't spread it to the women. But the other arm is, let's first of all even deal with the girls. Once a girl is up to 8, 9, and you are sure she has not been raped, of course, we don't expect an 8-year-old girl to be having sex, though a lot of things happen in this end world now. But from age 8, the girl child can have this vaccine. We call it HPV vaccine. Now, it's not like the common vaccine we take at birth, like all those BCG.
Yeah.
It's before it used to be expensive, but now it's very affordable. There are even some NGOs that give it free of charge, and it's usually in 2 or 3 doses. There's a type, I don't want to mention brand names, so that it won't be as if you're advertising for them. There's a brand that it takes care of 2 types of viruses, and there's another type that takes care of 4 types of viruses.
Okay.
So it is the one the patient can afford. At times, even if the patient can afford, it is what is available on ground. Just like when we were in that COVID-19 era, there were different kinds of those vaccines. So the vaccine is a primary prevention. You are sure that this girl has not had sex before, and that place is intact, then you give her the vaccine. So she's not going to have that virus at all. So our girl children can start having the vaccine from ages 8 and above. A woman that is now in a reproductive age group, like I said, 15 to 49, she needs to screen herself first. And if she doesn't have any sign that she has it, she too can get the vaccine. Do you get what I'm saying now? That
clear.
The children can have it, the adults can have it, but they need to screen before.
The adults will have to go through screening first to be sure.
Yes. There is a higher level of screening that I specifically mentioned so that I won't scare people. Our audience. There's one we call HPV DNA.
Okay.
That one is checking in the blood of the woman if she has the virus. But now it's still expensive, but some patients can actually afford it. So for that kind of woman, if she's boxed up enough, she can do HPV DNA or even do the other ones I said. And if they are negative, she can have the vaccine. The recommendation is every woman should get screened of cervical cancer once in 3 years.
Once in 3 years.
And if by the age of 65, 69, all the tests she has done is negative, she's free for life. She's good to go. But you need to be consistent with it. Once in 3 years, it's not bad.
It's still fair.
Exactly. Even we are supposed to be checking ourselves annually at worst. So that's basically the primary prevention. Also counseling against multiple sexual partner kind of lifestyle.
Yes.
You understand?
Yes.
Also ensuring that your immunity is boosted at every time, making sure you eat balanced diet and you have a healthy lifestyle. Okay? There's nothing we can do to my mother having cervical cancer, my sister. You can't change your mother, but you can always be proactive. So that's the primary prevention. The secondary prevention.
Before we move to the secondary prevention, you talked about the HPV vaccine, which is from the primary, and you said men could also do with this.
Excellent,
Yeah. So how can men go through this for if a man decides that I want to have the HPV vaccine?
Yeah, the man can just go to his doctor, the family physicians. They can give those vaccines. Nice. If they don't have, then they can come to the gynecologist.
Nice.
It's always available.
Let's go to secondary.
But usually we want to ensure that the female child has it first before the man. Exactly. Yeah. So, but it's very available and affordable now. Now, the secondary prevention is that we need to do what we call early detection.
Early detection.
Yeah, because if I don't detect it early, then by the time she's coming at the advanced stage in which the cancer would have spread to her spinal column, would have spread everywhere. And so there will be little thing I can do. If she's having anemia, her blood level is low, I'll need to give her blood. Even that one is dangerous because if as I'm giving her more blood, I'm also boosting the growth of that virus, of that cancer. However, the patient is pale, she's dizzy, she's been having fainting attacks, I need to give her blood. You know, then that's why the early detection is very important. You just don't go to quacks that will tell you this, and the thing will not be developing in your body and you don't know. So basically, that secondary prevention is the ability of a skilled professional. A professional is skilled, or other skilled personnel that has been trained in screening, in detecting, so that once we see it like this, before it gets to stage 1, we are catching it at CIN1, like I mentioned earlier, CIN2, we can quickly do what we need to do. You know, I mentioned something like if the woman is no more interested in getting pregnant, we can go. For those that are still interested in getting pregnant, we have modalities that we do for them. We'll check them, we'll give them some time, we can give them some injection, they wait for some time before we can get, go and get pregnant. They just don't get pregnant anyhow. So that's basically the secondary prevention, early detection. Now, the early detection and prompt treatment. Some people can call it early diagnosis and prompt treatment. Like, you need to know it is cancer that is coming. Don't tell me it's malaria. She's losing weight. You're like, it's malaria. Oh no, it's village people. You offended some people. Can't you remember? You know? So if you are able to detect it early, definitely you'll be treated promptly. Now, the tertiary prevention, which is the third level, is she already has it. And I now need to optimize her life. You would have had some people, they will say, I went to the doctor, they said I have bone cancer, and they said I should start writing my will. I have 6 months to live. We watch films, even not films, real life cases.
It happens. It happens a lot.
We have friends, we have families, and like that have those things. So the tertiary prevention means, okay, she already has it. What I now need to do is to improve the quality of her life. You know, she's having pain. Okay, I want to help her with some physiotherapy. She can't even walk. Okay, let's use a wheelchair. Okay, the thing is growing fast. Okay, I can't remove her womb anymore. Let's do radiotherapy that will reduce the rate of growth. The cervical cancer is very sensitive to radiotherapy. It's hardly sensitive to what we call chemotherapy. Chemotherapy is the use of some chemical agent drugs, and that one is better for cases like ovarian cancer and the likes. But for cervical cancer, radiotherapy is one of the palliative treatment. I need to mention what palliation is. Palliation is she's already in advanced stage. I can't help her in removing the cancer anymore. But I can help her control how the cancer is messing up her life in order for me to optimize the quality of her life. So when she's fainting, she's dizzy, and she comes to the hospital and I do her blood level is 20%. I need to boost it to like 30% for her. So I might need to transfuse blood. If she has come, she's having fever, somebody has been treating her for malaria, but her fever is due to the cancer, then I need to give her antipyretic, as in drugs or injections that will make the fever come down. Because if a woman has a fever that is so high, she can start convulsing. She can have a febrile convulsion, a seizure. Also, if it's something that the infection is much, you need to give her antibiotics to take care, because she's now going to be so exposed to a lot of what we call opportunist infections, because she's down. Any infection that ordinarily will run away, once they stay, they are going to become landlord and landladies in her body. So all those things are there. So that palliation is okay. All will be well, madam, but let's do the best for you. She's not eating well. I want to give her some drugs or some supplements that can
just keep her going. So when you talk about the primary, the secondary, and the tertiary, does this also come in line with age? Maybe when you're in the primary stage, you're from 15 to 20. Then when you get to, does it come with age, or is just a flow?
Is a like that primary, like I mentioned, from age 8, the girl can have it. Okay. You understand? I don't need to wait for when she's 20. When she's already in university, I need to mention this. A lot of mothers, a lot of fathers at times will bring their child to the hospital. The child does not even know why they've brought her. And she's like, what's wrong with you? I don't know. Ask my dad.
They just say she come.
But the parents have come to the back. Doctor, I want to know if she's still a virgin. I can't even ask her. You know, that's the way the world is now, you know. So, but if I'm sure that she's 8, she's 9, that's the best time, because if no pedophile has been molesting the child, she's not likely she has had sex at that age. But age 18 and above, when they say they're adults, some of them go and camp in their boyfriend's house for 1 month, and they will say they're in school. So you can't vouch for that. But that's why we need to be able to train our children properly.
Yes,
because definitely. It's not for them to do good things when they see us. It's for them to do good things because that's the right thing to do.
Dr. Fatima, I want to really thank you for your time. Our time is fast spent. I wish we could continue this conversation. Wow. You are most amazing, I must tell you that.
Thank you.
But what would be your medical advice to every girl child, every lady, every woman out there listening to you in line with our conversation today?
All right, thank you very much. I want to tell every lady out there, every mother, every sister, every man that has a sister, every man that has a mother, that has a girlfriend, that has a fiancé, that has a wife,
side chicks, and all,
etc. That please, it's a privilege that we can be able to screen for cervical cancer. It is not expensive, it is not cumbersome, and we'll be saving lives of the mothers of tomorrow. You train a man, you are just training an individual. True. You train a woman, you are actually training the whole nation. So these women, even though some stay at home, do some work, they are also part of the force of a nation. We need them to be able to take care of our men, our children, and the community. So my plea, my advice, that please, screening, we should not just say, I want to go and check for typhoid. That's what everybody does. I want to go and check for malaria. Cervical cancer is very easy to screen. It is a very curable one when detected early. So let us be it an onus on ourselves, make it a corporate social responsibility to tell people, have you screened yourself? And for us that we are now very learned, we should know that at least once in 3 years, we should tell our people, please, have you screened yourself? A lot of people don't even know what cervical cancer is. When you ask them, they don't know. It's unlike HIV that everybody
very
knows.
Very common and understandable. I want to thank you so very much, Dr. Mrs. Fatima Amoke Rabiu from General Hospital, one very good renowned consultant that I know. Thank you for your time with us in the studio today. The issues continues tomorrow on IKD 106.1 FM, same time, 11 a.m. But for now, I have to take a bow. My name is Opeyemi Adebambo, urging you to stay healthy, live a good life. Health, they say, is wealth. God bless you.